Thank you, everybody. And thank you, Liz.
Yeah, you're welcome. Okay, so the next slide is just a little bit about the center. Um, it's our mission is to build the capacity of communities to use alcohol science for healthy, safe, and equitable neighborhoods through evidence-based population level strategies. And we'll talk a little bit more about what that means. And the next slide shows that our strategy here at the center involves weaving together the alcohol policy field by reinforcing existing connections and integrating new ones. We offer community and state partners technical assistance to move toward the policy solutions that we know can make a lasting change toward excessive alcohol use prevention. And we do this by helping community and state partners identify strengths and gaps related to excessive alcohol use prevention, provide helpful resources, and connect with experts in the field who can guide you in developing and implementing tailored policy solutions. So you are really at the start of uh, this piece around the training and TA by getting this foundational base. The next slide shows that we are 100% funded by the CDC. And the learning objectives, I just like to have this outline on the next slide, Karen, is just, kind of where we're going a little bit. And I'm happy to come back when you need more information. I'll describe the trends in excessive alcohol use, including for Massachusetts, identify evidence-based strategies to prevent alcohol-related harms, and then we'll talk a little bit about the intersection of prevention and equity. So while this slide is likely a refresher for many of you, I just want to take a moment to clarify or to clearly define excessive alcohol use so we know what definition we're working from. And I know for some prevention folks or even community folks, this is a new idea that excessive alcohol use, when we speak of it, includes all of these types of drinking. So it includes binge drinking, which for women is 4 or more drinks consumed on one occasion, and for men, it's 5 or more drinks consumed on one occasion. It includes heavy drinking, which is for women 8 drinks or more per week, and for men 15 drinks or more per week. It includes any alcohol use by pregnant people, and it also includes underage drinking. So I think that's an important point when we hear data or information about excessive alcohol use, that it does include underage drinking, especially for those with the Stop Act grant funding or DFC funding, where alcohol is listed as one of the substances of use and concern. The other piece on the next slide that it's important to keep in mind is that most excessive drinkers are not alcohol dependent. So the vast majority, or 9 out of 10 people who drink excessively, do not meet the diagnostic criteria for alcohol dependence. Yet they are experiencing or contributing to alcohol-related harms in our communities. So alcohol use disorder is just one of the many potential negative outcomes associated with excessive alcohol use. And so I think really what this study reinforces is the need for primary prevention efforts and comprehensive evidence-based strategies, population-level strategies to prevent alcohol-related harms in our communities. And the next slide just shows the impact of binge drinking in alcohol attributable deaths and to the harms. So of all the different types of excessive drinking, binge drinking, which is that 4 to 5 standard drinks on one occasion, that's the most common, and it's also associated with the most harm. So 42% of the deaths and underage of excessive drinking are a result of binge drinking.
Wow. Sorry, I'm just struck by this.
Anyway, keep in mind when you're looking at your youth data, what type of drinking are they reporting? Just pose that question. So what works to prevent alcohol-related harms? Our next slide shows this wheel about what works, and I'm just going to go over them quickly here. So You may have heard, especially the SPAN staff may have heard of what's called the Community Guide or the Community Preventative Services Task Force. So that's a independent, non-federal volunteer body of experts in public health and prevention research, practice, and policy. And they have reviewed policies reviewed all the research, and based on scientific evidence, have found that these 7 strategies listed here work to prevent excessive alcohol use. So they include increasing alcohol taxes, which often occurs at the federal and state levels. It includes the regulation of the number of places where alcohol is sold in a community. And you think about points of purchase, not just physical places, but also the home delivery access as well. Limits on days and hours of sale, having commercial host liability laws, which means that the licensee is held accountable should they sell to someone who is underage, and that underage person then goes in as a result of being intoxicated, injures someone else. So they hold the licensee responsible. It's also called dram shop liability. The other strategy that has been shown to work is enhancing enforcement of laws prohibiting sales to minors and avoiding privatization of retail alcohol sales, which is basically what I'll cover this a little bit, but we talk about control states or private or licensed states. Massachusetts is a licensed state, so the state does not control any portion of alcohol sales. And we'll talk about what that difference is and what that means. But essentially what this is saying is that avoiding privatization of retail alcohol sales is a strategy shown to prevent excessive alcohol use. You can find these findings on the task force or from the community guide to identify intervention strategies that you could use for your community. But overall, by using these strategies to reduce excessive drinking, it could help reduce the risk of developing alcohol use disorder, among other alcohol-related harms. And it's the next slide, just another graphic of those 7 strategies. But I wanted to point out, and you may have noticed, that these strategies address the affordability and accessibility of alcohol. So take regulating alcohol outlet density, for example. When there are many places that sell and advertise alcohol in a particular area, people tend to drink more. Excessive alcohol consumption causes a number of health and safety problems, from car crashes to cancer. And when communities set policies so that alcohol outlets are fewer and farther apart, it improves health and safety. So that's an example of how one of these strategies would work to improve health and safety. So the next slide, we're going to talk about how underage drinking is associated with adult drinking. So those 7 strategies that I listed, those strategies to prevent excessive alcohol use among adults can also reduce underage drinking and a range of alcohol-related harms. So strategies that can effectively reduce excessive drinking among adults can reduce, I just repeated myself, underage drinking. I just really want to drive that home as an underage drinking prevention community that, and funding that you receive. So the research shows that there is a relationship between youth drinking behaviors and the drinking behaviors of their adult relatives, of adults in the same household, and adults in the same community and state. So you want to think about really what that's saying. Yeah, you can click through this and keep it on this slide, Karen. Thank you. That when we are addressing excessive alcohol use among our adult population, that can impact the underage drinking rates and the youth population. There's been new research and that indicates that adolescents whose parents drank frequently or binge drank, those adolescents had a significantly higher odds of drinking than the adolescents whose parents did not drink or who did not binge drink.
Excuse me, Liz.
Mm-hmm.
Sorry to interrupt. Maureen has just arrived.
Oh, great. Hi, Maureen.
Good morning.
Hi, sorry for being late.
That's okay. Maureen, welcome. We are here with Liz Parsons, and would you mind just doing a quick introduction of who you are for Liz and vice versa? Thank you.
Oh, sure. I'm Maureen Callahan. I work for our state representative, Denise Garlick. She represents all of Needham, all of Dover, half of Medfield, and I work as her district director and keep an eye on specifically Needham and Dover, and also work with a lot of different constituents that have concerns and need help with state agencies. So that's my role here.
Great. It's very nice to meet you, Maureen.
Nice to meet you too, Liz.
Thank you.
If you have any questions, we're saving them till the end, so please jot them down. And I've shared these slides with Karen as well. So please feel free to ask questions at the end, and especially if you feel you've missed something. I do not mind at all repeating. Okay, so so I just wanted to say again that new research about the adolescents whose parents drank frequently or binge drank those adolescents had significantly higher odds of drinking than adolescents whose parents did not drink, respectively. Again, driving home this point of the associations between adult drinking and youth drinking. All right, the next slide. There is even a separate study that shows the relationship between alcohol policy, environment, and youth drinking in communities. So the stronger the alcohol policies, even those policies that do not target youth specifically, the stronger alcohol policies are related to a reduced likelihood of youth alcohol consumption. So these findings suggest that efforts to reduce youth drinking should incorporate population-based policies to reduce excessive drinking among adults as part of a comprehensive approach. All right, so the next slide, oh, thank you, Karen. There is researchers have developed a state-specific alcohol policy scale. I don't know if you, Vanessa or Monica or Karen have seen this before, the APS. And they have the alcohol policy scale. They scored alcohol policy environments, and they've studied changes in these scores from 1999 to 2018. And they found that very few states have restrictive policy environments. Although states have adopted policies targeting impaired driving during the study period, there was no change in policies to reduce excessive drinking. So there is room for improvement. And I can share a little bit more about the APS scores with you if you're interested. All right, the next slide. So I just mentioned the lack of policy change is concerning because these are the alcohol-related harms. Each year in the US, excessive alcohol use is responsible for more than 140,000 deaths. 1 in 5 of those deaths are among adults ages 20 to 49. And over $249 billion is the economic cost, and that's just over $2 a drink. And that figure is for the last time that that data has been available, which was 2010. It is currently being updated, but you can imagine that that will have changed. And alcohol-related deaths, just another snapshot here. They've increased over the past.
Last time, and I'm like, I don't know where the.
Oops.
Sorry. They've increased over in the past decade, and the 1 in 8 deaths are among adults ages 20 to 64 were attributed to excessive alcohol use. And this chart shows all deaths from excessive alcohol use and what the chronic and acute conditions were. So there were chronic conditions like heart disease and stroke, liver disease and cancer, and acute conditions like poisonings, alcohol poisonings, motor vehicle crashes, and suicide. One issue here that I'd like to highlight is cancer. I've mentioned it a couple of times. It contributes to 9% of deaths from excessive alcohol use. February is Cancer Prevention Month, so it's a timely, to pull this information out and highlight it. And I think it's really
Liz,
important because,
are there
yeah,
specific types of cancer it's linked to? Because that's news to me, and I'm wondering if it's just a very specific type or if it's more broad.
yes, there are specific types. I believe it's linked to 7 types, and I can tell you exactly. It's so as you might imagine, it's cancer of the mouth and throat, the larynx, the voice box, the esophagus, colon and rectum, liver, and breast cancer. And I can share some more facts, some more information with you about the connection. One of the things, let me just go back. So let me tell you a little bit about how that happens. So alcohol, is a major risk factor for cancer because the body breaks down alcohol into a compound that damages cells and slows cell repair. So excessive alcohol use can allow cancerous cells to grow and spread. And this explains why the less you drink, the lower your risk for cancer.
Thank you.
Yeah, you're welcome. There is a lot more information about this. As I mentioned, there have been studies done that show there is not a wide, I think, don't quote me on this, but there's not I won't give us a statistic. I'll find it for you. But there is, many people are not aware of that connection. And we have heard of communities and states trying to raise awareness about this connection, including, and the CDC has this information on their site as well. So these are harms to the individual who is doing the drinking, but we know that there are other harms, as you all know and address in Needham, is harms to other people, other than the person who's drinking. So that list is equally long: physical, sexual, and psychological violence, harms to fetuses from drinking by pregnant people, crashes involving other drivers, passengers, or pedestrians, property crimes, financial harms, child maltreatment and neglect. And then, as I mentioned before earlier, an age of initiation of drinking and increased frequency among youth. And there's also,
Sorry.
yeah. Oh,
You want me to go ahead?
Nope, this is fine.
Okay.
Thank you. The equity consideration here is what we call the alcohol harm paradox. So it's the observation that people of low socioeconomic status tend to experience greater alcohol-related harms than those of high socioeconomic status, even when the amount of alcohol consumption is the same or less than for individuals of high socioeconomic status. So it really speaks to the social determinants of health and how the inequities related to the social determinants of health. And we can talk more about that after. All right, so yes, now the next slide, and I'll show you a little picture of Massachusetts. So I meant to mention this before. The CDC has state fact sheets for every single state. So this is just pulled from their site, showing the latest data from Massachusetts. So there are more than 2,750 deaths from excessive drinking each year. Again, this cost to the state, $5.6 billion, was from 2010. So we would expect that would be different now. that would be 20 cents per drink sold, would be the taxes that are collected. And you look on the left, but it's costing the state, it's according to 2010, $1.93 per drink. And then the next slide is the comparison from the national in Massachusetts, the percentage of adults who binge drink. And the percentage of high school students who binge drink, just above the national average for both of those. And among adults in Massachusetts who binge drink, 25% consume at least 7 drinks on an occasion, and they report binge drinking at least 4 times a month. And I'm sure you have your own Needham specific data that you could add to this picture as well. Okay, so the next portion I wanted to talk about was alcohol regulation in the US. And this was because Karen and Vanessa expressed interest in really, I mean, in all of this is to sort of lay the foundation about alcohol policy and regulation in general. So I think it's really important to understand the history so you can understand the present and what's happening in your state and community. It's really key to understanding and preventing alcohol harms. So there are the pillars of alcohol regulation. And just to quickly provide some historical context, in 1933, the 21st Amendment repealed prohibition. So all of the states would ratify the amendment and determine how they would regulate alcohol. So you can click through and see these bullet points, Karen. The purpose of alcohol regulation is first and foremost to protect public health and safety. I'm going to say that again. The purpose of alcohol regulation is first and foremost to protect public health and safety. It's also there, was created to ensure efficient tax and revenue collections. And it's to eliminate unfair or illegal marketing practices, while also trying to balance the interests from the public, including, from a health and safety standpoint, as well as from an economic standpoint. So the next slide, this is just a snapshot of the cover of a book that was pivotal when the 21st Amendment was repealed. In 1933, John D. Rockefeller Jr. commissioned 2 people, Raymond Fosdick and Albert Scott, to study alcohol regulation and prepare America for the return of legal alcohol and its regulation. And so they produced this report, Toward Liquor Control, which provided guidance to policymakers as they set up regulatory systems for alcohol. And much of this framework still exists today, which is why I think it's important to know what's in this book. So the report recommended 4 specific measures for states to consider when regulating alcohol. The first was to reduce aggressive sales tactics, such as an incentive to consume in high volume. Can anybody think of what that might look like today? I think of
limiting, like in Massachusetts anyway, not having happy hours, not encouraging, over serving or over drinking.
Yeah, great example. That could be an example of encourage incentive to consume high volume. The other measure was to prevent the vertical integration or vertical monopolies where one tier dominates over the other. And I'll talk about the 3-tier system in a second. So there should be 3 separate tiers that controls the sale of alcohol, and not collapsing those was a specific measure in this report. And to restrict outlet density, the days and hours of sale. So that was put in there to curtail public order problems by restricting density. And we just mentioned those 7 effective strategies. Population level strategies and outlet density was right there as one of the examples of being most effective. And lastly, it was to place more limits on high ABV products, so alcohol by volume. So we're placing restrictions on high ABV products. Okay. So the next slide, I mentioned the 3-tier system. So it's a unique regulatory system for alcohol. It's the foundation for alcohol regulation in the US. And I want you to think about this model in our current situation and alcohol landscape. So it's simple in theory. The manufacturers, as at the top, or the producer, it says, they provide alcohol products to the middle tier, they're wholesalers, who distribute the products to the retailers and the licensees who sell to the consumers. So no one entity can be involved in more than one tier under most state models, and each tier is regulated and licensed separately. So that's the theory. It's an hourglass structure with producers at the top, funneling down to the wholesalers in the middle, where they can track at that wholesale level. They'll track if there are any public health concerns like tainted alcohol products. And that's where alcohol tax collection occurs. So if you think back toward liquor control and the measures, what people thought were important was public health and safety. So tracking that tainted alcohol could be a public health piece, and it was about collecting tax efficiently, and that's where that happens at that wholesale level. And then it fans back out to the retailers who get the product to the consumer. So this 3-tier system operates in the background to ensure that product safety, to ensure tax collection, and prevent market domination by restricting any one tier from having a financial interest in another, a common practice in the pre-prohibition era that led to aggressive sales tactics and heavy consumption. So when they did have a financial interest in more than one tier, that led to aggressive sales tactics and heavy consumption. All right, the next slide, I mentioned before control models and license models. So another takeaway from the Toward Liquor Control was the recommendation that states adopt the control form of alcohol regulation. However, the authors and the research team who wrote the book recognized that most of the states would likely not choose this path. So what's emerged across the country are 2 primary forms of state alcohol regulatory structures, the control model and the license model. As I mentioned before, Massachusetts is a license model. The names are misleading, though, because no matter what state system you have, there are still elements of control and licensing in both systems. So the element that distinguishes one from the other is that under the control model, the state owns part of the alcohol business, usually the wholesale or retail operations. So think New Hampshire. And all control jurisdictions sell wholesale spirits. Some have wine and beer, while others have state-run stores selling spirits. Sorry, selling beverage.
You said the control model. Okay, you just repeat. So you said like New Hampshire, for example, they control part of like the wholesaler system, and what else? Or production, you said, or retailers.
So when you go to New Hampshire, the state liquor stores, what are they selling? They're selling spirit-based alcohol, and then they can also so the state-run spirits, and but you don't find beer and wine at those state stores, right? Beer and wine is sold by you know, the other licensees, retailers, but not state-run.
Okay, thank you.
Yeah, no problem. And if you're interested in different types of control models, I can share some of that information with you too. But in Massachusetts and other licensed states and jurisdiction, alcohol is distributed and sold by the private sector only. All right, so here's a picture. Sorry, you can click through. Karen, I should have had you click through because it had the definition there. For those visual learners who like to see it. So these are the control jurisdictions throughout the US. I got this slide from the National Alcohol Beverage Control Association. So it's NABCA. Maybe you've heard of that before. But nearly 25% of the US population lives in a control jurisdiction. And then the next slide, just these, I'll share these, Karen, you have them. These are additional resources for communities related to the content area that I spoke about with you today. So there is the Alcohol Policy Information System, which provides detailed information on a wide variety of alcohol-related policies at the state and federal levels. And it also has information around the recreational use of cannabis there. I mentioned NABCA. They have this Alcohol Regulation 101. I believe that's a short webinar or maybe a presentation, which is great if you want a refresher for alcohol regulation, how it works. SAMHSA has recently put out an implementing community level policies to prevent alcohol misuse, which I believe you have seen. And that really summarizes key policies identified as evidence-based based on the literature. For those of you here who haven't heard of the Alcohol Action Network, they are, there's American Public Health Association, which is, is a national public health association. They have different sections depending on topic area, and they have an alcohol, tobacco, and other drugs section. And within that ATOD section is the Alcohol Action Network. And it's a great twice a month network of prevention professionals, both at the community, state, and national levels, all getting together, learning about many of these issues. And so it's a way to create awareness and learn, as well as be in a space with people who are doing similar work. So it's a great resource. They have a 10-minute clinic, a quick 10-minute presentation on preemption and alcohol policy, which we didn't cover today, but we can talk more about, and how understanding preemption is important. And there are a lot of resources there to help you understand that. And that's basically means what can you regulate at the local level and what needs to be regulated at the state level, depending on your state laws. And then lastly is this resource from Change Labs, that's Understanding Prevention. If you haven't worked with Change Lab before, which you may have, because I know Carol Reed has before, there are great resources for public health advocates who want to understand the basics of policy and why it matters for health equity, including issues like preemption. And so I highly recommend using Change Lab resources, and I can send you some other links. They have equitable enforcement to achieve health equity. So if you're thinking about working toward a policy solution in your community, really looking at the sort of roadmap for incorporating equity at every stage of that process, Change Lab is a great resource for that. Lastly, you can certainly use our website. We have plenty of resources there. If there's something you're looking for but can't find, please feel free to reach out to me. And if you have any questions, you could email or obviously just reach out to me anytime. So that's the official presentation. I don't know, Karen, if you want to stop the recording.